Hi, everybody. My name is Kristen Hall, and I'm here with Brainstem at Rice University for another neuroscience video. And today we're going to be continuing our brain tumor series, and we're going to be talking about the diagnostic process. So let's get started. We're going to start off with a little bit of a review. So here are some questions that you might want to think about before we begin talking about the diagnostic process. What are brain tumors? So brain tumors are a mass or growth of abnormal cells in the brain. They can be benign or, they don't spread, or they can be malignant or cancerous, but they usually cause symptoms and can be dangerous even if they are not cancerous. What are the different classifications of brain tumors? There are many, many types of brain tumors. And once you add in the cancers that can spread to the brain, there are too many types of tumors to name in this video. However, some of the ones that we talk about a lot and that are important to know are astrocytomas, glioblastomas, and meningiomas. Those are some important names to remember because they'll get brought up in the future. Brain tumors can be classified by origin, cell type, and grade. And we actually have a brain tumor classification video if you want to check that out to learn more. Then finally, what symptoms do brain tumors usually cause? Signs and symptoms of brain tumors depend almost entirely on where they're growing in the brain. But there are some general symptoms that are sort of hallmarks for brain tumors, and these include headaches, vision problems, loss of sensation in parts of the body, problems with speech, balance issues, problems with hearing, mood changes, confusion, difficulty concentrating, and seizures. So what happens when you start to have one or more of these symptoms, and what will your doctor do to give you a diagnosis? Well, they're going to start off with a neurological exam. So when you go to your doctor with some of the symptoms we talked about, there's going to be lots of things that they will be looking for. Some of those symptoms, like headaches or hearing problems, can have a lot of different causes, some of which are not nearly as concerning as a brain tumor. However, if simpler causes have been ruled out through blood tests, imaging, or other exams, your doctor will want to do a focused neurological exam. So you're probably going to be referred to a neurologist at some point during this process. Neurologists are doctors who specialize in the brain and the spinal cord. They know a lot more about the nervous system than your family doctor will, and they're going to be very equipped to diagnose and treat brain tumors. A neuro exam consists of testing the patient's mental status, motor function and balance, senses, reflexes, cranial nerves, and coordination. So for mental status, at the beginning of the exam, the doctor is going to simply converse with the patient in order to gain an understanding of their mental status or their level of awareness and interaction with the environment. So someone with an intact mental status will be fully aware to person, place, time, and event. The doctor may ask questions like, what is your name? Where are you? What day or month is it? What were you doing before you came to my office? And the doctor is going to observe the patient, and they're going to look for clear speech and making sense while talking. And they'll kind of gain an understanding of, is this person mentally intact? Do they have full awareness of themselves and where they are, or is something off? Next, the doctor is going to assess motor function and balance. So the physician will ask the patient to push against his or her hands with their hands or feet. They may also ask the patient to walk or stand to observe their balance. The patient may need to stand with their eyes closed while the neurologist pushes on them slightly, and the patient's joints will be checked through movement either from the doctor or the patient. So the patient may move his knee himself, or the doctor may push on it. Next, for sensory, the neurologist will use a variety of tools and instruments to test the patient's ability to feel. So they may use dull needles or tuning forks or alcohol swabs or objects with certain temperatures, and they're going to touch the patient's arms, legs, and other body parts to see if the patient can identify the sensation. Next, they're going to test reflexes. So they're just going to see, are their reflexes present and normal? So you've probably had this done when your doctor hits on your knee with a hammer in your family doctor's office. That's testing one of your reflexes. And people of different ages have different reflexes. So babies have something called a palmar reflex, where their hand automatically grabs anything that's put in their palm. And so if you have a baby that's having a bunch of symptoms that could be neurological, the doctor's going to test that. For adults, they mainly just test the muscular reflexes. And so they're going to use a hammer and hit on your joints to see if the reflexes are intact. Next, for cranial nerves, there are 12 cranial nerves, which are nerves that come from your brain, and they control important motor and sensory functions. They're listed in the table here. You don't need to memorize these. You don't even need to know what they all do, but just know that they each have specific functions that can be tested with different exams. For example, cranial nerve 1 is the olfactory nerve, so it controls your sense of smell. And it's going to be tested by having the patient smell things with their eyes closed. Cranial nerve 11, the accessory nerve, it controls the neck and shoulders and can be tested by having the patient shrug or turning their head from side to side. And then finally, for coordination, the patient will be asked to walk in a straight line or touch their finger with to their nose with their eyes closed, just to see if they have full coordination. Next is imaging. So once your doctor does the neurological exam, they may find some things that are not quite right, and they're going to assume or predict that you might have a brain abnormality. And so once they think that you may have a brain tumor, they're going to need to figure out where it is, how large it is, and what type of tumor it may be. So a lot of tumors can be identified by their shape. For example, butterfly tumors are tumors that look like butterflies, essentially. They extend into both hemispheres of the brain, and they can be seen in this picture here. They kind of look like butterflies in that they have wings and they expand into both hemispheres. And these tumors are always glioblastomas, which are a very, very deadly form of brain cancer. We have a previous video about glioblastomas, and they can be they're very recognizable on MRI scans. Speaking of MRIs, brain tumors are most typically diagnosed with MRIs, or magnetic resonance imaging. Here you can see some examples of brain tumors that showed up on different types of MRI scans. So these are not all the same type of tumor, but they're located in the same area, and you can see how they appear differently with different types of MRIs. So you have a normal MRI, and then you have an MRI in the middle with contrast, which is a dye that is injected through an IV in your arm to help the radiologist see the structures of the brain and the tumor better. And then you have a functional MRI. fMRIs are used to show the thinking process and the process that happens within the brain. So the areas that light up when you think about certain activities, or when you hear music, for example, are correlated with different areas of the brain. And so a lot of times tumors will light up on these MRIs and be really easy to visualize. A lot of times other types of scans are used, such as CT, which is computed tomography, and PET, or positron emission tomography. And the doctor will determine which type of scan is best to use. It depends on the tumor and on the patient themselves. Finally, we have biopsy. So once it's determined that the patient does have a brain tumor, biopsy is going to be the next step in the process. When imaging reveals where the tumor is, a neurosurgeon or a brain surgeon will perform a surgery called a biopsy. A needle will be inserted through a hole in the skull, and a small sample of the tumor's tissue will be pulled out for analysis. The tumor is going to be examined under a microscope to determine if it's benign or malignant. Sometimes biopsy can also reveal additional details, such as the prognosis or possible treatment options. Here is an example timeline of a patient with a brain tumor. So keep in mind that every patient and every tumor is different, and sometimes a full neuro exam isn't performed, or different imaging is going to be used. Neurologists go through several years of school and training to understand the tumors that they diagnose, and diagnosis is a very complicated process. So every patient is going to have a different experience. Once a diagnosis is made, there may be treatment options available, and we have a video on brain tumor treatments if you want to check that out to learn more. And then that's all for brain tumor diagnosis. Feel free to check out the Brainstem YouTube channel to learn more about brain tumors and other neuroscience topics, and thanks for watching.